I'm Carrie, Director of Women's Health at Tomah Health.
And I'm Tammy, Coordinator of Women's Health.
On this edition of Health Check 360, we're going to take a behind-the-scenes look at women's health services at Tomah Health.
Today we're going to meet Paige Wogan, our certified nurse midwife, along with Tim and Samantha Larson.
Welcome to our women's health services here at Tomah Health. This is part of our nursery station. We also have our nursery and our central monitoring. And this is our nursery. This is where babies can come to help, let patients sleep while they can. And if they need a little extra assistance, we watch them here if we need to. The warmer is something that we will utilize after birth or if they're coming here for testing in the nursery. It gives us oxygen capability as well. We have our hearing screener over here, which is what we do to test for, make sure babies can hear. One of the options we have here at Tomah Health is our telemed unit, which is connected to the Gunderson Health System NICU. It's kind of like a fancy Zoom with the capability of the NICU team being able to see the baby, listen to baby, has a specialized camera so they can really look up close so we can determine what can we do here or do we need to transfer to a higher level of care.
We're going to continue our tour down at the labor rooms.
When planning our facility, one of the things that we wanted to make sure was super important is our location. We made sure we were close to the OR so that way if we needed to go for a C-section, we could get there quickly. And welcome to our labor room. This is one of our suites where we have the hydrotherapy tubs so patients can labor and deliver in the water. They stay here for about 2 hours after delivery and then go to our postpartum rooms.
My name is Paige Wogan. I'm a certified nurse midwife at the Tomah Gunderson Clinic.
Water birth is an option here at Tomah Health. It's a great way for patients to have a low intervention birth by being able to move around in the water freely. A lot of times patients ask, does the baby take a breath underwater? And that's not the case. They're born right into a temperature that's the same as inside mom.
I think women that want to have the option to have a more natural, unmedicated birth, the water birth allows them to achieve that. Typically in labor, when women get in the tub, they tend to just have a point of relaxation because they get so much relief from the water. And after, they say it's a beautiful experience because after baby's born, they come on mom's chest and they get a time to bond in the water with their baby.
About 10% of our vaginal deliveries are water births, and it works well for those patients that are able to get in the tub. We also like to use it for them to labor in, and maybe they just get out right beforehand, but it's a great option and tool for our patients.
Most dads are pretty hesitant about delivering in the tub, but unless they've had a baby before that was a water birth, we welcome them in. We pull up a chair next to the tub. We encourage them to be hands-on, and it's a beautiful experience. We dim the lights. We try and make it as relaxing as possible for them.
And we're going to continue our tour by going into one of our postpartum rooms. One of the things our patients truly love about our experience here is that they can leave the labor behind in the labor room and come to our comfy postpartum room. The queen size beds are a great option for both families to stay in the room and really care as a family unit.
Each of our rooms come equipped with a fridge and freezer for the families to use during their stay as well.
We have lots of space so like family can come and visit, and usually they stay about 2 days. The support person or dad can stay overnight with them and help with the care, so it really promotes bonding. We deliver about 225 babies a year. We are the only hospital in Monroe County that does deliver babies. I think it's a testament to our facility that we are committed to providing care close to home. It gives them opportunities for family and friends to be able to get here for the birthing experience and not have to drive.
At Tomah Health, we actually offer several different classes to the public. We offer childbirth education class, sibling class, water birth class, and breastfeeding class, and they're all free for our expected parents.
I do clinic at Tomah Health, but then I come over here for deliveries, so my patients deliver at Tomah Health. I love being able to provide full around care from their initial prenatal visit all the way through their 1 week and 6 week postpartum visit. It allows me to get to know the patients on a personal level, and then the patients then feel comfortable in their labor and delivery experience with a familiar face. I think being first-time parents, you come in and it's very scary. You don't really know what to expect. So to come in and be a provider that they've seen before and that they are able to trust and feel comfortable with, I think that takes a little bit of anxiety off of the whole process of bringing their baby into the world.
Paige was so helpful, so much great information, but also it wasn't too much information. It was just what we needed to know, and very easy to work with, but also felt like we had done this before even though we never had.
I really enjoyed how calming her presence was. She kept me very informed the whole time. She made me feel very comfortable throughout the whole process.
I got to know Tim and Samantha really well throughout their prenatal appointments. It's always nice to have a family where the dads are super involved too, and he was so supportive during her labor, and they just were a perfect team together, and it was a really beautiful birth.
Part of our opportunity for supporting our patients after they've delivered is giving them a lot of education, supporting them through lactation consultant visits, as well as partnering with our rehab services department to help them get back on their feet after they go home.
Another option we have for new parents, that car seat, it can be a challenge to install, and we do have a certified child passenger safety technician that she can see all parents either before they have their kiddo or after and help them learn how to install that seat. At Tomah Health, we really do provide a team effort. It is very important, and we do provide the training and tools for our staff.
Tomah Health is the right place for moms to have their baby because we give individualized care, we put them front and center, and we really want to make them have the best birthing experience possible.
Tomah Health, together in care.